sponsored by the Bay County Prevention Network, which has been in putting prevention into practice since 1989. Also, Mid-State Health Network, thank you for their support in allowing us to do these kind of things as part of our prevention plan, as well as the Substance Abuse and Mental Health Association Community Talk Program. Today is the day 4, final day of the game plan, putting prevention into practice about underage drinking. Today, we're going to be talking about the roles that individuals and communities play in underage drinking. So with that said, let me get us started. I do have a screen I'd like to share. Let's see if we get this right. All right, technology working for us. That's good to know. Awesome. All right, so we do have a slideshow that I like to, just a reminder that underage drinking is not a minor problem. Youth can't drink, the adults don't provide. That is the message that we're trying to make sure of. So let's talk about some of the roles that individuals play. Let's talk about the solution. We've been talking about the problems pretty much all week. Let's talk about some solution. I think that's an important thing to do with that process. First and foremost, the Bay County Prevention Network uses a evidence-based planning tool called the Strategic Prevention Framework. And in that Strategic Prevention Framework, we do an assessment. This is where we gather data, both that's from a numbers standpoint and getting information from people, as well as looking at the resources that are out there in our community and what resources we might need to make sure that the interventions, preventions, programs that we end up doing are going to be most effective. Then secondly, we also look at the capacity. We try to see how much human capital we have, financial resources, time, talent, even treasures in some respects. After we've looked at those, by the way, assessment capacity is something that's an ongoing thing we continue to do. Then we plan. We plan based upon the information, and we develop what we call local plans for local solutions, local problems for local solutions. So basically what I'm saying here is that everything that we plan on doing is something based upon our locality, not based upon just somebody saying it's a good idea. It is some evidence-based tools that we use, but it is that process. Then we move to the implementation process where we need to make sure we're implementing things and we're checking things along the way to make sure that it is doing what we want it to do. And finally, really not the last step, but kind of the first step prior, kind of as we move through assessment is kind of used throughout, is evaluation. What are the outcomes we want to achieve? How are we going to know we achieve those outcomes? When we're looking at evaluation, we're not just looking at the after the program's done, we're looking at the beginning, we're looking at the middle, looking in between. So hopefully we're evaluating anywhere from 90 to every 3 months to every 6 months to see whether or not it's meeting our goals and objectives that we have established within our plan, which in turn, by the way, we're doing a plan and we're creating a logic model. It basically says, here's the root causes, here's the data to support those things, here's the local condition that says that that actually is a problem in our community, and here's the data, whether it's from numbers or people discussions, that supports what we're talking about. And encapsulated in all of that, we're looking at how can we sustain those efforts and how can we make sure that we're taking into account the culture of our community. That isn't just about Black, white, Hispanic. It's looking at the culture, what people think, what people value, what people believe. Those are the kinds of things we're talking about. So as we move into that, then we move into the social ecological model. And as you can see, there's different layers that we're looking, kind of like a stone being thrown in the water, but like an onion being peeled. And a lot of times everybody wants to focus on the individual knowledge and skills. And that is where a lot of people can actually have an impact personally. Then we have the interpersonal, where that's the family and the social networks. And that's where families can talk about that. We'll show you some things that parents can do. Then there's organizational things that can be set in place that actually can make things that are going to be more successful. And then we move in that community realm. What can the community do to help with the individual, interpersonal, and organizational, and make it easier for those things to happen? And finally, we have that public policy as well that we have to be concerned about. So as you can see, we use a planning model. Within that planning model, we're looking at the individual, the interpersonal, the organization, the community, and the public policy. But then we take a look at something called the spectrum of prevention. And there are three main individual things that are done in our community and other communities across the country: strengthening individual knowledge and skills, giving you information to help you to make informed decisions, to help you be educated about the information. That's all promoting community education, such as doing some marketing campaigns as an example. Educating providers. When it comes to alcohol, that's about educating the people that are responsible for serving the alcohol, following Michigan Liquor Control Commission rules and regulations, as well as offering something called techniques for alcohol management as well, either as a service that the Bay County Prevention Network pays for with some of our grant funds, or as a way to subsidize some of those costs as well. And then as well, we move into the environmental part, which we're fostering coalitions and networks, changing organizational practices, influencing policy and legislation. And by the way, individual are great to do, and you have to balance individual environment, but our environment is more bang for your buck. So as you can see here, I broke it down in that way. Individual strategies are about providing information, building knowledge, changing attitudes, developing skills. And the environmental is about changing consequences, changing physical design, such as a fence, or making it that individuals have to have an ID scan as an example, and modifying and changing policies that are going to make the most impact to respect the individual freedoms, yet also protect the public health at the same time. And that's something that we strive for tremendously when we're trying to develop programs and strategies here to make sure we're balancing those two. So some of the environmental strategies we're going to be talking about today will be communication, enforcement, and policy. Communication is where parents and even youth can be involved in. The enforcement and policy issue are things that the community can be involved in. So I want to talk to you today about a campaign launch we're doing today called They Talk, They Hear You. And as you can see, this is designed to reduce underage drinking, and it is a Substance Abuse and Mental Health Association program. So it's all done, it's all available. But the first I want to do is I want to show you a short video to really show you what this means. This is kind of a discussion starter for maybe you parents maybe have with your young person. So I'm going to let this video go, and I'll be back in a few minutes. I'm going to go ahead and mute myself so you don't have to worry about looking at me. And I'm going to go ahead and play the video for you. Here we go.
If you're talking, they will hear you every single time. Allow the words to break through by seeing eye to eye. We all mean something special to each other's lives. So talk, they hear you, and you can do it if you try.
It's all right, man. We're good next time.
Good seeing
Really
you.
good to see you. You take care, okay?
Bye.
Hey, pal.
Hey.
Tough game.
Yeah. You guys really needed Kyle today. Where was he?
It's complicated.
Come on, Tim, let's go.
Just a sec. Okay if I go over to Jake's for a while? We're gonna eat lunch and then hang out.
Yeah, sure. Your sister's still at her sleepover for the day. We're getting her at 5 and then we'll come and get you afterwards, okay?
All right, cool. All right, come here.
Bye. See ya.
Talking, they will hear you
Ready?
every single time. Allow the words to break through by seeing eye to eye.
So you know why Kyle wasn't there today? He's kicked off the team.
What?
Yeah. Got caught drinking alcohol in the park a couple nights ago with some other kids.
Did Tim tell you that?
No, I heard it from Rick just now at the game.
Wow. Do you think Tim's drinking too?
I don't know. I hope not.
Yeah, but we never really told him what we expect.
I know, but what do we expect? I mean, kids tried at this age.
Some kids, but that doesn't mean that we should just assume or wait for it to happen with ours, does it?
No, of course not. I just can't believe we have to have this conversation at his age.
We probably should have had it a lot sooner. And not just one talk, but every time there's a chance to discuss it. You know, just reinforce what we expect.
Yeah. We'll definitely do that with Katie.
And with Tim. I mean, this situation with Kyle is the perfect opportunity. I think if you talk to him, he'd listen.
Allow the words to break through by seeing eye to eye. We all need something special to each other's lives. So darling, here you can do it.
Hey, pal.
Hey, where's Mom and Katie?
Mom's picking her up. I wanted to get you so we could talk about something.
What'd I do?
I'm not sure. That's why I wanted to talk. I heard about Kyle and why he's off the team.
Yeah.
Mom and I were surprised. We hadn't really been thinking about kids your age starting to try alcohol. Have you tried it?
No. I mean, I've been around kids that have, like Kyle. I mean, I don't know.
Well, here's the thing. We realized today we haven't really been clear about alcohol and what we expect. It's really important to us that you do not drink alcohol.
Okay.
There are a lot of reasons why. Most important is that we care about you. At your age, alcohol can damage your brain development. It messes with your judgment, so you can end up doing dangerous, risky, or just plain stupid and embarrassing things. And there are consequences. At school, on your teams. Look at Kyle.
Yeah. I get it.
Good. We also know it can be hard to turn down alcohol if your friends are drinking. But all you have to do is say, no thanks, it's not my thing. You've got so much going for you, Tim. You don't need it. And your real friends aren't going to care if you don't drink.
No thanks. It's not my thing. I can do that.
I'm proud of you, Tim. Your mom and I are here for you anytime you have questions or need help. With this or anything else.
Thanks, Dad.
So now that you've seen that video, let me get back online here. Sorry about that. I'd like to get some of your feedback. And we're monitoring the comments box as well on the Facebook. What were some things that you saw in that video that the parent did that were effective in getting the message across? Such as how are they doing their messaging and what was important to talk about? So I'm going to go ahead and check out our Facebook and see if we got anybody over there doing anything as far as any comments. Okay, since I'm not seeing any comments, I'm going to go ahead and go further, but I'd love for anybody that's watching this video either now or in the future, tell us what some things you got out of the video. But I actually want to take you to that actual site to the parent resource page. Because in that parent resource page, there are a lot of tools that parents have available to them. Just as an example, this is what we did yesterday, 5 conversation goals. And if you go down here, there's actually a little handout you can use, and there's postcards you can use if you need that as a parent to help you when you're having that conversation. There's also answering tough questions. That's always a tough one for a lot of parents sometimes. So if you're not sure what to say, so let's just take a quick look at it, see what it says. So here you can see, why is alcohol bad for me? I got invited to a party. Can I go? Did you drink when you were a kid? Why is marijuana bad for me? Why do you drink? What if my friends ask me to drink? So there's 3 different pages here you can look at for different information. So what role do parents have? Parents, you are the first line of defense. You are the first line of defense determining whether or not your son or daughter is even going to entertain the idea of that. We even have a family agreement form that you can get as well from here. Once again, it's just breaking it down for you. Here's kind of the English version here. There is a Spanish version as well, saying what you agree to, what they agree to. I strongly encourage you, if you're a parent, to set this expectation, because then it helps them understand the importance of what you're talking about. It reaffirms it by making that commitment to your family. Okay, and then just as an FYI as well, they actually have a mobile application. So you go to the store and you put in Talk They Hear You campaign. There's actually there's a 1-pager as an example, and Talk They Hear You is the name of the app, and it has all those sample conversation starters, way to get it going, practicing. You can earn some badges. Tell us if you end up using that mobile app. We'd love to know that. Hashtag it, not a minor problem, in our chat. That'd be great, in our comment section. So let's keep going with that. So now the parents know what is expected of them. What about youth? Well, let's talk about that. Let's move down here a little bit. It's really important for youth to have a say-so in the issue of underage drinking. Youth in the past have made videos to let not only their peers, but their parents and other youth know that underage drinking is not a good idea. And we'll post that video during New Year's Eve, because it was such a great video that the youth did for our youth ambassador program. We want to be able to use that again. But if they want to be engaged in being part of the solution to this, send us a message on Facebook and let us know they're interested. We'd love to have them involved in the process. That would be really beneficial to both aspects of it. So then we take a look at, so what's going on here? Well, when you're looking at doing alcohol, it is a community thing. What you see in front of you is a list of the different organizations that we have engaged with regarding the underage drinking for one way or another. Youth organizations such as the Boys and Girls Club, MSU Extension, YMCA, youth themselves. They need to have that competence. They need to have some usefulness, and they need to belong, and they need to have influence. They know more about the problem than we do. So let's get the information from them. Let's work together on that. We have the state strategic plan. If you go to put in alcohol, underage drinking strategic plan for Michigan, there actually is a strategic plan written by what's called ORAS, Office of Recovering Oriented Systems of Care, which has it in there. We've also engaged with Mothers Against Drunk Drivers. In the past, we've done some things such as tie one on, where we have ribbons we tie on cars, make that available to people in the community. We've worked with businesses to do that as well. We have alcohol policy councils that we work with, such as the National Alcohol Action Network. We work with a program called Prevention Plus. Prevention Plus Wellness basically is an opportunity where we can help youth to kind of get a self-assessment of where their wellness is. And once they know where their wellness is, they set some goals. If you're interested in that as a parent too, you'd like to have your student do a wellness assessment. It's pretty easy. It's not too difficult. We can do it in a half hour on via Zoom or even in person. I strongly encourage you, because when they do the goals, they make them very specific. They say who they're going to share it with. They say where they're going to put it. And then basically gives them an opportunity to have that. We work with the healthcare system. One example of that is at McLaren, they have what they call a Velcro wall, and we put up alcohol awareness stuff during that time, as well as work with times where we've had screenings during Alcohol Awareness Month in April. We've worked with Michigan Licensed Beverage Association to help with the TAM training for those that are techniques for alcohol management, those that are servers. And we've worked with them for at least 4 or 5 years. We've worked with the SAG groups, the youth SAG groups, Students Against Destructive Decisions in various different schools to work with them. We work with parent groups such as the Great Start Collaborative. We worked at them. We worked some churches on getting information out there. We worked with law enforcement as well, providing information. The courts, we have diversion programs that we do, Prime for Life program, which can be done in 4, 8, 10, 12, 16, 18, and 20, depending on the level of concern. We work with schools doing various different projects. We've done things with Vernac ISD Career Center. We work with local government as well. We actually have the mayor on our Not a Minor Problem Underage Drinking Task Force. We work with Saginaw Valley State University as well to work with the fetal alcohol syndrome aspect of it, the My Babies Project. Continue to have some discussions with them. Work with Safe Journeys to help with doing some healthy outcomes. So that's things all the community can do and are doing. So let's talk more about some strategies about the community. There is social access and retail access. Social access is another lever the parents have. Parents, you can have an influence on that. Because if they have the availability of the alcohol, they're more likely to drink. So the social access is huge. And if you don't have discussions with those parents that your teens or youth are going to, you don't know whether or not they're providing. And as you remember in the last data point that Katie talked about, I think it was not yesterday, but Tuesday, that getting it from someone else, adult, is pretty high in the level of the Michigan Profile for Healthy Youth. But then we also have this thing called retail access. And we wanted to see whether that was an issue. So in collaboration with our local law enforcement here, we actually partnered with them to do some compliance checks. If I remember correctly, they did about 13 or 14 of them, and almost 50% sold to a minor. So that was concerning. So we're looking at also doing some follow. So what can you do as a community member? You can remind individuals to check ID, number one. Number two, if you're at a place and somebody checks ID, whether it's at a bar or restaurant, or even a Walmart or any other convenience store, 7-Eleven, etc., you can thank the patron if they do check ID, because that sets a precedent, realizing that that is important. Remember, youth can't drink if adults don't provide. And then in terms of policy, and that's where our community can get involved. Social host ordinances. I know that we've had some things in the past, but with this one is getting people to understand that if you do host, you're going to have some consequences. And those policies, by the way, can be formally and informally. Formally, we could have consequences from a legal end, but what if we made it something that parents and everybody in the community use also as a tool to informally let people know how we've thought that that was a bad idea. It's a social host for young people. That would be an example. So we have responsible sellers out there. We have MIP diversion programs where we have a neighborhood resource center that does things for Prime for Life, as well as the Sacred Heart Rehabilitation Center. And we can offer that to anybody that would like to do it. That is a free service at the Neighborhood Resource Center. It's a free service. We also take a look at outlet density. We look at how many bars or restaurants or alcohol establishments there are in our community. If you don't know, we have one of the larger levels of outlet density than a lot of people in the state. Yet our population size isn't as large as a lot of other ones that have higher concentrations of alcohol in their communities. Now, I'm not saying people can't drink. Let me make that very clear. But we know there's a correlation between the more outlets you have, the greater the risk is for people to end up having access to availability of the alcohol. From a policy standpoint, from a legislative standpoint, nobody likes to hear increases. But if we increase the tax on alcohol by 5 cents per gallon, it would bring in millions of dollars. Like I said, no one likes to tax. I understand that. But that is a policy that can be effective in restricting different things as well. Like I know we have no sales after 2 a.m. That's restrictive. That's an example. Making sure we have festivals and things like that, or even the Feed in the Street program. You can only drink in a certain area and following the rules and regulations set forth by the Michigan Liquor Control Commission. These are all different things that could be done regarding policy. And some of those can be done formally, as I said, through laws. But I think a lot of these can be done informally as well. Making the seller responsible doesn't have to be a ticket. We're willing to go to any place that would let us, and we'll have some people that are 21 and over, that necessarily don't look 21 and over, do a mystery shop to see whether or not people actually are selling to minors, or at least checking their ID. That is an opportunity, and we're willing to work with any business to do that. We won't charge the business one dime to do that, by the way. So let me talk a little bit about what Bay County has done. We've done in the past, we haven't done it recently, we've done in the past, we've done a pre and post test to find out what people knew and what they didn't know. And what is ironic is the things that people didn't know before are exactly the types of things that we're finding out that people don't know again. So we need to do a better job as a coalition to make sure that we're educating people in those areas. We've done interviews in the media on the issue of alcohol. We've done press releases. And we take a look at these stakeholders. We have Technique Alcohol Management, already talked about compliance check, CAPT, which is now Teens Advocating Prevention, have done things in the past, such as Taiwan I talked about, alcohol and drug-free events, which that is looking to be also revamped, as well as opportunities for conferences. And we've marched in the parade in the past. We also did a reward and remind program with the 14 that were involved in the compliance check. Those that were compliant, we gave them a letter and a certificate saying, thank you for doing a great job. We really appreciate everything you're doing, signed by the mayor and our chief of police. We also did a remind for those that sold to a minor, reminding them how important it is not to sell to minors, and giving them some tools and strategies that help them to be successful in future endeavors. By the way, those that did sell also report to the Michigan Liquor Control Commission, so they understand the severity of what we're talking about. So If they were to use like a mystery shopper ahead of time and check ID and really know what's going on, that could be a preventative measure that would help them to not have that issue again. We also do school programs, as I said earlier, and different community events. And finally, we do parent communication materials. So you're probably saying, so what role does each of these organizations play? So let me stop sharing here and finish with this. Parents, number one, you are the first line of defense. You can have discussions about them, about alcohol. The second thing you can do as a parent is hold people accountable and remind people about the social host issue. Thirdly, parents, you can thank and remind retailers about checking ID and serving to minors and what the ramifications are and what the positives are if they're not selling. Youth, what can you do? You can join the Teens Advocating Prevention Group. And in that group, you get to choose the issue, design the intervention, get the information for the intervention, plan the intervention or strategy or program, implement, and evaluate. By the way, ladies and gentlemen, that's using that strategic prevention framework I talked about earlier in a very simplistic manner. So think of it like this. They know what the problem is. They get educated all they can about that problem. They learn skills and strategies that are beneficial to them. And then using those skills and strategies based upon the problem that they have chosen, based upon those chosen skills and strategies, they then can put something in place that they want to be successful with. Okay, so that's Parents IU. What can community members do? Number one, hold that social host ordinance available. What I'm talking about, informally especially, can be formally as well, making a report. Secondly, there's social hosts, you can educate people about this information you've learned about on these Facebook messaging the last 3 days, 4 days, including today. What I strongly encourage you to do is share all of these videos. If I would get 1,000 views, that would make me ecstatic. Right now, on the first video we did talking about what's the big deal, we have about almost 200 views. So you can share this with all your friends and family, every single one of these videos. That would be great. Because if they share it, we get it wide and far across the scope there. So we got social, educate, and then what about advocacy? Yeah. Maybe you want to have a conversation with your policymakers. You can write a letter, you can call them about underage drinking. Maybe some things that maybe they should put in place, such as maybe looking at increasing taxes. I know nobody likes to hear that, and I understand that. Making sure licensing is done, not just for TAM training for those that are serving alcohol in a bar or restaurant, but what about convenience stores as well? What about making them have to have a TAMS person trained? That might be a policy. Or how about just letting them know how important it is to support public health and policies that are regarding underage drinking? So balancing the two and looking for support and even recommendations or even advice from people in the public health field, such as myself and my colleagues, or that's from a local level or even a state level. So hopefully today you get an idea what the roles were, the different things we are doing regarding that, what the Talk to Hear You app is, what the Talk to Hear You campaign is, and what you can do to utilize that. We will be using that Talk to Hear campaign, and look out for, let's say, Thursdays and Fridays is when we'll have information on Talk to Hear You posted on our Facebook pages. Either weekly or bi-weekly, it'll be on there, depending on our schedules. So please comment and tell us what you thought of this series of information. Let us know of any additional topics you'd like us to touch on. We're looking at vaping and marijuana series in 2022, probably opiates as well, maybe doing some interviews. Give us your thoughts, give us your opinions. Remember, this was the game plan, putting prevention into practice series on underage drinking. Youth can't drink if adults don't provide. Underage drinking, not a minor problem. Merry Christmas and Happy New Year.